taking you to Tamale and then to Bono East and Kumasi from issues happening in the region. But Murtala is standing by currently to talk to us on a summit, that is Social and Behavioral Change Health Summit, which is underway in Tamale currently. So Murtala, good morning and thanks for joining us this morning.
Yes, good morning. Thank you very much, Mavis. We are coming to you live from Tamale, and yes, it is a health summit on behavior change. Attitude, they say, is everything when seeking health, an improvement in the health of the people. This morning, we are gathered here, brought together by a civil society organization, NORSAC, and they are telling us or revealing some evidences they've gathered from across various districts in the northern region about some activity that they have carried out in the area of family planning, sexual reproductive rights, and others. I have one of the project officers here, Mohammed Smaila. Good morning, Smaila. Thank you very much for joining us here. So, Health Summit on Behavior Change. Tell us why.
So, with respect to this particular behavior change, I'll just start by sending us back to say that this project is by name Accelerating Social and Behavior Change Project. It's a 5-year project we are implementing. And then, as part of this implementation, we seek to achieve some 3 resource areas. One has to do with letting Ghana Health Services when it comes to behavior change. The second aspect has to do with we putting in strategies basically to be able to generate some community demand for the health products we have at our various districts. And then lastly, we want to see how private sector can also have interest when it comes to health issues. So basically, these are the 3 areas we want to achieve in this particular project. So as part of measures, to be able to document some of these particular changes in behavior, we need the districts to come here and then showcase the evidence to the entire world. And for that matter, for their colleague districts to also learn some of the best practices they have been practicing at their various areas. So what has necessitated this particular evidence summit is for us to appreciate some of the evidences of behavior changes that is working, and practically has to do with how the community health management committee members are being spearheading these particular changes by themselves. Just to tell you that behavior change is in us, and then we can move that particular change ourselves.
So this is a collaboration between you and the Ghana Health Service and the various district health directorates. Now, if I may ask again, you have your participants from across various districts. What are the evidences they are providing you from their communities?
Okay, so just to say that we are actually implementing this project in the consortium. So Ghana Health Services, and that they take the lead. And you would have seen that when I was talking about the resources it's for Ghana Health Services. We have other partners which are existing. They are the prime partner of this particular project. We have NORSAC, we need the resource leader too. And then you see that is one of the bases for which we have gathered here. And then we also have Savannah Signature, we have Malele Ghana Community also being part of this consortium that we're implementing this particular project. Now, back to the issue you just asked, that has to do with we have so many people, districts coming here. They are bringing evidences in the area of malaria, they are bringing evidences in the area of family planning, and then they are also bringing evidences in the area of wash and nutrition. These are the areas we want to contribute towards behavior change. So they have this particular stories at their community level that is bringing some kind of change into the communities. And then we want to feel appreciation of the evidences they have generated. And then we are also following up to the community levels to be able to appreciate some of these evidences they are presenting. And then as also a build up to the bigger summit. So this is a mini summit, and then the mini summit is going to build up to the bigger summit, which will be taking place in Accra in August 2024. So it's going to be a larger platform, and then these evidences they are showcasing to us today would be showcased at the Greater Accra level on some of the issues that they have. So this is a mini evidence summit, and then we'll have the bigger evidence summit at Greater Accra level.
Hold on a little for me. Let me go to our officer from Karaga. Tell us your name.
My name is Idris Alasan, the District Health Promotion Officer for Karaga District.
Tell us about some evidence that you have gathered from your districts that shows that there is changing behavior towards healthcare.
Okay, so looking at the ASBC project, it's a community level intervention where CHMC members are being positioned and of course empowered to take decisions regarding their own health. By doing so, they will identify the community issue with available data from the health facility. Then they will try to see how best they can be able to mobilize resources in order to address their health problem. So looking at the intervention when it started in our district, for example, we can count a number of interventions or things that the community health management committee have done in respect to changing behavior in their various communities. For example, my story for today is talking about Nambrugum Chiefs compound where they feel it is important for all mothers to come to ANC as early as possible. So we're trying to solve a problem of first trimester. Initially, people did not want to come as early as possible.
Because let me explain this. Because I know in the northern region, among certain ethnic groups, a woman within the first trimester cannot even say that I have missed my period or I am pregnant, and that resulted in delays in coming for healthcare service or ANC services within the trimester, and that has often brought about challenges, sometimes miscarriages, other times it caused other problems towards labor. How is this behavior changing with this intervention?
So like I earlier mentioned, the community people thought it was that it is important for all pregnant women as early as possible to go to the health facility. So for that matter, they come together, all the communities under that chief's compound. It has 10 communities. They brought all the stakeholders under this 10 communities to let them know that coming to health facility as early as possible has nothing to do with our tradition. So and for that matter, the pregnancy or the pregnant woman need to come to the facility, take the necessary services that will be required, get back to the house, then all the customs and other tradition that they need to perform, they can still perform it at the house. So for that matter, the people realize that health service is different from the tradition. They are not saying they shouldn't perform their tradition, but they should allow the pregnant women to come to the facility for services. So they all agreed, and the people started bringing their pregnant women, even though they will not announce it to the community that my woman is pregnant, but they will secretly send the pregnant woman to the health facility for the health staff to render services to them. So this was one of the areas that they thought it wise. So as it keep on moving or improving in terms of the early ANC, they thought is that if people are coming to the facility as early as possible, continues the ANC attendance, it is important for us to ensure that all those facility delivery by ensuring 100% all pregnant women within the catchment area to deliver the facility. So in doing so, they themselves ask themselves, so what would be the possible issues that will prevent us from achieving that? Then they thought it is important for them to get extra building for maternity services. Earlier on, the facility was using only one room for ANC, for CWC, for delivery and other services. But the community people thought it was that they need to build additional structure so that it can take care of deliveries and ANC services, which they actually did. They equally identified that some communities are far from the health facility, and for that matter, they need to find a way of transporting the pregnant women to the health facility for delivery. That calls for the sex commission at various communities where pregnant women are always sent to the health facility to deliver, and the transportation fund or fuel will be reimbursed after the delivery. And some community, for example, Kubo, the chief donated his private car for the services to be run within the catchment area. Any pregnant woman that is due for delivery, the car is available to transport that particular pregnant woman to the health facility. So in terms of the ASBC activity, it has really generated a demand for health services, and the community themselves are able to identify issues affecting them in terms of health and the way to mobilize resources on their own to be able to address them.
Right. Thank you very much, Alhassan,
yes.
And we wish you the very best of luck as you move back to Karaga. Let's have Hajia Hafsa here. That's closely related to this issue we are having here is the issue of family planning intake in the region. It remains very, very poor. How is this accelerated social change behavior activity changing this narrative?
Yeah, so we all know that behavior change is difficult. We also know that we need to also repackage our messages when it comes to ensuring that people understand and also appreciate the issue, as well as demand for the services. We all know that in the context where we live, women do not easily take decisions by themselves when it comes to family planning. And so that is why we are trying to redirect the discussions with men. And so it has to be more of a community level approach to ensure that both the couple are engaged, and also looking at the young people having the consent from their families before going in for the family plan. So we are repackaging our messages and conversations to ensure that we are able to target this. Yes, family planning has been low, and I think that the thinking or the perception around family planning has been the one dragging the whole show. It's not to say people should not give birth, it's to also space birth. But I think our initial conversation around family planning did not help, and that is why we are repackaging the discussion and conversation to see how we get the community level approach where the community engagement for health and well-being is used as a tool to ensure that we get everyone understanding the process and also having the space and comfort to access.
Haja, hold on a little. Let me go back to the studio. Let's see if Mavis has any question for myself or for you, Mavis.
Yes, Murtala, is a good initiative to repackage all the conversations and make it strategic and redirect it to men. But the point I want to raise is how important how has it helped over the years, or these few times that they are doing, how has it helped the repackaging of the information? How has it helped towards reducing some of these misconceptions on family planning, sexual health and things? How has it helped?
So, Adia, the question is, how has this SABC initiative helped in addressing some misconceptions and myths people held around family planning, maternal and infant healthcare, for example, attendance to ANC?
So that is why I initially mentioned that it's a community level approach where the communities themselves sit to discuss how issues should be addressed within themselves. And so it is more of the communities influencing the community to take their own initiatives. And that is why we feel that the community health management teams or committees, they have to handle the issues. And so they are doing more of the sensitization, and there's more around using the indigenous approach to that. And so if you look at what we are doing, you realize that Ghana Health Service, because we are looking at sustainability, they are driving the process and they are using their structures at the community level. So the CHMCs who have over the time not had capacity, we have built their capacities in the areas where we are targeted to ensure that they have the adequate knowledge, they are able to use the strategies well, and then they continuously review their action plans to ensure that they are up to date.
Yeah, Mavis.
If she can help us with it. the areas they are targeting for this social behavioral change issues?
Okay, so my uncle in the studio wants to know what are the targeted areas. We've talked about maternal health care, we've talked about ANC. Yeah.
So we are looking at WASH, we are looking at malaria, we are looking at family planning, we are looking at maternal neonatal child. We are also looking at nutrition. And then we are looking at the communicable diseases. So specifically, we are looking at COVID and also any emerging disease that comes up that we target. And we have a target. Actually, at the baseline, we are looking at, by the end of the 5 years of implementation, we increase each of these areas by 10 to 12% at the baseline.
Yes, maybe. So you heard Hajia Hafsa Sumani say, one of the participants here at the summit, and the summit is on social and behavioral change. And by the way, who is sponsoring, who is funding this whole project?
So we are a consortium. We get the funding from USAID through AVHI 360. Right. And the consortium members are NOSA, Savannah Signatures, Malindo, and the Ghana Community Radio Network, and also AVHI leading.
Hajia, I want to thank you very much for your time. Mavis, so yes. This is the situation we have here at the Health Summit in Tamale. And participants here are very optimistic about outcomes in the area of malaria treatment, especially for children, maternal and neonatal healthcare, family planning, and other areas. Back to you in the studio.
Mutala, before you run off with me, as a 5-year implementation plan, we hear Hajia saying it. Has it started? And when is it ending? And again, if you know, that is if you know. And again, is it going to be done in the Tamale, as in the northern region, only the northern region areas, as far as these issues are concerned? And can you help us with the communities?
So I'm aware that this is taking place in some selected districts, including Karaga. You just heard the Karaga officer telling us what they are doing in their community. There are other districts involved. Unfortunately, Hajia and her team have left me here. So it is a 5-year project. It started somewhere. Let me see if I can get Hajia so I can get details of the years. Hajia, we are not done. Let me see. Okay, thank you. So 5 years, when did this start? When is it ending?
So we started in 2022 and we'll be ending in 2026. That is the project.
All right. Thank you very much.
All right, that was Mutala coming to us from Tamale on the Social and Behavioral Change Summit, which is being held in Tamale. So it started 5 years ago, and it's a 5-year implementation issue or project, of which it will be ending in 2026. So they are looking at repackaging information and strategically redirecting it, the conversation of healthcare in the areas of family planning, sexual and reproductive health, nutrition, malaria, emerging infectious diseases, and neonatal and maternal health care. They want to redirect the conversations with the men so that at least they will push the women to seek for assistance or to seek early care anytime they have issues bothering their health and reproductive health. So this morning, what is happening currently in GBC is the fact that GBC is launching the GBC's policy guidelines for election 2024 to streamline coverage of elections during and before, before the elections. So it's on the theme, Ghana wins election 2024. We want to provide coverage, free and fair coverage to all political parties. That is currently what is happening in the studios of GBC this morning. We'll bring you update on that in our subsequent bulletin. Let's go for a very quick break, after which we take you to the Bono East. Thanks for staying and watching Real Time, coming to you live from our studios here in Accra and streaming live on our Facebook channel, GBC Ghana. So just went by was a report from Tamale on the Social Behavioral Change Health Summit, which we want to redirect the conversation towards men to ensure that the women go to the antenatals as early as possible to prevent all the neonatal deaths that is happening in the northern region. So we're going to Kumasi briefly to talk to Nicholas on the Deeper Christian Life Churches Winning the World Through Social Intervention Crusade. So Nicholas, good morning and thanks for joining us.
You're welcome.
Yes. Tell us what is happening and where you are in Kumasi currently.
Good morning, maybe. I'm coming to you live from Kumasi, from the Pempa Assembly Hall, where there's a congregation of Christian leaders who are planning towards a word crusade orchestrated by the Christian Deeper Life Ministry, with their founder, Pastor Kumuyi, expected to be the guest speaker, and the program is scheduled at the end of from in the Kumasi. Key now you are seeing in your which has brought together key Ashanti from and
the program has many of the spiritual group
and deliverance. They are going to get for the kingdom. They are also going to take up the needs of the people. To get a sense of what the program is going to be, I'm going to speak to one of the key leaders of the program, and he is the regional. He is in charge of Kumasi South. I'm going to speak to Pastor Oseya Owusu of the Deeper Christian Ministry, and he has a deeper insight into actually what is happening. I may not be able to give you details of it because I'm not a member of the planning committee. But once they are deeply involved, they should be able to tell us exactly what the whole program is going to be. I'm sure, just as Jesus once said in Matthew chapter 10, verses 7 and 8, and then yes. He told his disciples to go and heal the sick, cleanse the lepers, and then save the lost soul for Christ. That's exactly what the Deeper Christian Life Ministry is going to do here in the Ashanti region. But they are going to ride on the wheels of social interventions. But I will not want to take the sail out of the wind as I speak to Pastor Oseya Owusu. Pastor, good morning.
Good morning.
You are live on GBC News, one of the TV channels of the Ghana Broadcasting Corporation. We want you to help us understand what is this global crusade with Kumuyi all about?
Yes, global crusade with Kumuyi, GCK. The goal of it is to help the nation, especially to help those that are causing havoc in our nation to have a change of behavior and attitude. It is the crusade time is open to everyone to be there. And the goal is to preach the sound gospel of our Lord Jesus Christ, to help those who are in bondage of the devil, so that they will have their freedom from Satan and have peace and joy to live their simple life and enjoy the nation as well. It is a program also that through that many has been able to experience hope for their lives, hope for their families, hope for their businesses, and hope for their future. It is also time that God manifests himself in a very special way, healing the sick, delivering the oppressed, and many have been set free through such programs. And we are believing God that this coming GCK Kumasi, especially Babayara Sports Stadium, is going to fulfill the desires of God and for us to enjoy the fullness of God as well.
Thank you. But we know that Jesus' ministry on earth was not only about saving the soul, even though that was the primary mission of him on earth.
Yeah.
He also took care of the sick.
Yes.
And even raised the dead. Yeah. Apart from you evangelizing to the lost, the world, the mortal world, what else are part of this schedule?
Yes. We are going to begin from 21st to 24th. Before the crusade starts, we are going to have what we call medical missions. We have about 40 medical doctors coming from USA. Some are coming from England and some are coming from Nigeria to team up with our Ghanaian medical team to take care of the people. So we'll start by taking care of maternal 21st in maternal care at the Prempeh Assembly Hall here, that will care the mothers, especially pregnant women from 6 months up to mothers that are having 6 months old babes. And we have a package for them. There are a team of doctors that will be helping them, and we have something to also present to them. On Monday, 22nd, it will be a general time to care for all those that are having any type of sickness to be catered for. And there will be minor operations that will be taken care. All those that they will diagnose to see that they need some minor operations will be taken to some hospitals that we have here, man, to do such operation free of charge. In fact, everything is free of charge. At the same time, from 22nd to 24th, part of the team will go to prison, Central Prison, Ghana prisons. I mean, Kumasi Central Prison and then Menchia Prison to take care of our people over there.
Their health needs.
Yes, their health needs.
We are also told another aspect of the social intervention is got to do with drilling or boreholes for communities that have issues. Yes. That have issues with water supply.
Yes.
What about that too?
Yes, we have done one at Bofodu. As I'm talking now, we are mechanizing it at Bofodu, which is under Atumakwa district. As I'm talking to you, that they are working on it too. I'm sure before the weekend they will complete it for the youth. There will be also tree planting. Also in some places. It's part of what we think we can also do to help the climate. I mean, the challenges you are facing.
Militating against the climate change.
Yes,
okay.
Change.
Okay.
Yes.
From what I'm seeing around, it looks like you are making heavy investment. Where are you getting the money as a church?
From people who love God. People who love to see that others enjoy life. People who are thinking about the betterment of others. So voluntarily, people are giving to support this great project.
Finally, before I take leave of you, Pastor, it looks like this is a congregation of the Christendom in Ashanti region.
Yes.
I could see leaders of various denominations from across.
Yes.
How do you see the participation and involvement of these Christian members of the Christendom?
Oh, very, very encouraging. Because all the Christian bodies in Ashanti region, they are involved. We have Kumasi Christian Churches Council involved, Ghana Pentecostal Council involved, independent churches are involved, main Christian Council even involved. We have all of them together. In fact, together we are having this program. All the Christian bodies in Ashanti, they are together with us to hold such a great program.
I'm grateful for speaking to us. Mavis, do you have any question? But this has been the head pastor, so to speak, for Deeper Christian Ministry Ashanti South, in charge of the Santase denomination or the congregation, so to speak. And he has been telling us about the Global Crusade with Kumuyi. That is scheduled for the end of this month. But before then, they will be taking care of the sick, their health needs. They also be taking care of the water needs of some people, and then they also be taking care of the environmental needs by way of planting trees to mitigate the harsh effect of the climate change. And so, here from the Ashanti region, precisely the Prempeh Assembly Hall, Nicholas Osei-Owusu reporting to you.
Nico,
maybe if you have any questions.
Nico, before you wrap up with us, we know this crusade this is not the first time. It has been going on over and over every year. How impactful has this their intervention as far as the crusade is concerned? Their social intervention that they have aligned with the crusade, how impactful has it been over the years?
Could you come again? The lines were breaking, so I couldn't get the full.
I just want to find out from you if the Reverend Minister is still with you. We know that this Kumoji crusade, global crusade, this has not been this is not the first time it is happening. It's been happening over and over, and we want to find out how impactful has it been as far as the social intervention aspect of the crusade has been.
Okay. Pastor, my colleague in the studio is asking. She's finding out from you. This is not the first time you're organizing such a global crusade. It's been happening over the time. How impactful have the previous ones been, especially the social interventions you provided?
By the grace of God, many lives have been changed. But that one, they are enormous because the results of this program is so great because we have drug addicts who have a change of behavior, and as I said, many are having hope. Many are having hope. As far as the medical mission is concerned, in fact, last year we couldn't do it in Accra. This is the first time we are doing it in Ghana. So for that, other nations, I can talk about what happened in Nigeria, how it has helped a whole community to change, like what we are doing, the borehole. I mean, drilling a borehole for the society. What we are doing at Bofod, at Tuma, the way they are rejoicing, the way they are praising, even though we have not finished, the people are praising God and rejoicing for what He has done. So in brief, that's what I would say.
But Mavis, please pardon me. There's something of interest to me. I would want to find out. Pastor, have you done with the provision of the water? Because my community too is in bad need of water.
We will continue to do it. We can't do everything. Once you have started, we will continue.
Okay.
We will continue doing in the other environments. I mean, other towns and villages will be doing for them.
Okay. I'm grateful. Okay. Maybe is there any more question for me?
We are fine. We are good to go. Thank you so much, Nicholas, this morning coming through from Kumasi on the Deeper Christian Life Church winning the World Truth Social Intervention Crusade. So the Deeper Christian Life Christians winning the World Truth Social Intervention is going to happen from the 22nd to 24th of July this year in Kumasi, of which they are trying to bring doctors from across the country and others from the US to join the Ghanaian doctors to take care of women or in maternal health care. They will be going to the prisons to support them in their health care as well and be drilling some bowls in some communities that they have selected. So this morning, right at GBC is launching the GBC's political broadcast guidelines for election 2024 under the theme Ghana Wins Election 2024. This is to give a fair coverage to all political leaders or all political parties in the line of these elections or election 2024. It is to help strengthen democratic culture in the country and afford the public the best possible opportunities to make informed choices about the political parties and their candidates. So there will be some discussions as far as GBC is concerned. We are providing the political leaders a free platform that they will be doing the Manifesto Watch. There we have My 10. We have adult education in all the local languages. There will be breakfast show for them. That will be on TV. And in radio too, we'll be having the Decision Time in English, Manifesto Watch, Decision Time in local languages, all in the bid to ensure a free and fair coverage for election 2024. That is Ghana Wins Election 2024. That is all time will allow us this morning on Real Time. My name is Mavis Ofe Champon. We came your way live from Tamale, where there is a social behavioral change health summit talking about malaria, neonatal death, and family planning and sexual reproductive health. Thank you so much for joining us. We're bringing you details of the Ghana Wins in our subsequent bulletin, and the news comes up at 2. Thank you. Good morning.